And welcome to tonight's edition of the One Hood Power Hour. I am your co-host, Kahari Mosley, here with my illustrious co-host, Miracle Jones. How you doing tonight, Miracle?
I am doing well. It's a busy week here in Pittsburgh as we come down to the launch of the Labor Day weekend. Started off the week, with some news that's going to be a huge Labor Day weekend here in Pittsburgh because the president will be here to partake in some of the festivities for Labor Day. For people who are not aware, Pittsburgh has one of the largest Labor Day celebrations in the country. Parade. It also signifies the kickoff of the official kickoff of campaign season for the general election. So it's going to be a very, very busy week here in Pittsburgh, but it's also an opportunity for people to engage, like the officials from all sides. I'm going to talk about the issues that impact them, and so you'll see Pittsburgh being in the news a lot this week, which are very fortunate. How was your weekend, Kari?
Yeah, well, it was good. I went to Maryland to attend a bar mitzvah for a family friend. A young man who's very close with my son, played a lot of baseball over the years. And they're a family who lived in Pittsburgh for many years, but recently moved to North Carolina. And and they celebrated the bar mitzvah in suburban Maryland. And it was a great experience, a great weekend. And the boys had a lot of fun. They got to see some friends who they used to spend a lot of time with, who obviously, as the years move forward, as they grow up in North Carolina, they won't be able to hang out so often. So it was a great weekend for everyone.
No, that's great. And I think that speaking of what's going on here in Pennsylvania, unfortunately, with campaign season, there's highs and there's lows. And today, actually over the weekend, there's been a lot of conversation about gubernatorial candidate Mastriano and his outreach for his campaign after he was accused of not only celebrating the Confederacy, but dressing up as a Confederate soldier for a family and friends like Day of Remembrance, in addition to also possibly producing some films about Nazi and Nazism, just from a historical aspect. Of course, the campaign has been very robust in their defense of not only the celebration, but the film. However, this debate really indicates how the Pennsylvania election is going to be a very contentious one as opposed to prior years. People are really digging into all of the candidates, not only their personal stories, but their previous social media posts and outreach. And we've seen that really come to a head this weekend with that story. But on top of that, we've also seen some reports that talked about how more people are engaged this voter election. There is going to be record turnout. People are registering to vote in record numbers. And so it's going to look like Pennsylvania is going to have a healthy, robust election this year, which continues to be a topic of debate, as some people have suggested that this may be an off municipal election year, or others have said this may be one of the most expensive elections that we will see in our lifetime. Again, this is considered to be the billion-dollar election cycle here in Pennsylvania. So please make sure you're tuned in whenever you can. There's a lot of issues, and we'll talk about some later today, but a lot of issues come down to who's on the ballot and who gets put in office. So you have to, unfortunately, stay tuned in to all of these candidates and all of these campaigns year round.
Absolutely. And before I get into some recent polling, I did want to send our condolences out to the family of Jack Shea, who passed away, the former head of the Pennsylvania, well, not Pennsylvania, but the Pittsburgh area AFL-CIO, the longtime Central Labor Council leader, passed away. We were talking about, Labor Day, so I'm sure next Monday on Labor Day, there's going to be a lot of remembrances, and so I just wanted to send that out to the family of Jack Shea, former head of the Pittsburgh Allegheny County Labor Council, passed away today. But back to polling. Emerson put out a poll recently that shows that the race is a lot closer than some of the polls earlier this summer may have suggested. Currently, this Emerson poll has John Fetterman ahead 48-44 over Mehmet Oz, and Josh Shapiro up 47-44 over Doug Mastriano. So, this was a recent poll taken by Emerson College Polling, which is, considered a reputable polling outfit. And so this has a much, much closer count than, we may have seen the almost double digit leads that, we were accustomed to over the summer. We are getting closer to Labor Day, and the true campaign is really going to begin as I suspect all these races will continue to tighten as we get closer to November 8th, unless something unforeseen happens. But for now, this does appear to be going the way many pundits had suggested.
Yeah, I think polls are always interesting. As a reminder, polls don't vote; people do. So you still have to get out and involved. But the polls are really showing that this is not going to be a landslide election. It's not going to be a blue wave or a red wave, as people have projected. All of these races are very close. We're still looking at what's going on in the congressional race was between Summer and Republican Mike Doyle, not to be confused with former Congressman Mike Doyle. There are a lot of races all across Pennsylvania that are within less than 3 points, and it's going to be up to the candidates and their platforms and how they are reaching people to get people inspired and motivated to vote. And one person who did that was right with a few feathers today was senatorial candidate John Fetterman, who put out a call for the Biden administration to actually take a platform on adult use cannabis and to actually come down for legalization and be ahead of the visit here in Pittsburgh. That has been causing some conversations. In addition, Republican candidate Mehmet Oz has been putting forth some of his platform initiatives, as well as going through his own round of personal attacks. So it's going to be very interesting as we get down to November to see what's happening and what cause people to get out to vote. But it's very, very important, as we've seen, last week, here in Pittsburgh, a representative was under anti-Semitic attacks. This week, Mehmet Oz has been under xenophobic attacks. For people will be mindful that these election cycles are about issues, and we don't have to personally attack people's religion or identities to motivate people to come out to vote. That we can really have a campaign on the issues and to remind people to not get sucked down and bogged down with the negative of the political campaign season. There's a lot of things happening, but people can really go out there and really meet neighbors, talk to people on their issues without being divisive and bigoted.
Yeah, and along the lines of the Senate race, Dr. Oz is actually in Monroeville right now, hosting a town hall called A Dose of Reality Town Hall at Premier Automation in Monroeville. The event was scheduled to start at 6:30, so I'm sure tonight and tomorrow, we'll hear more about how that event went. So it's just showing that the campaigns are truly, truly starting to pick up. There's activity all over the state. As I just said, Dr. Oz is in Monroeville as we speak. And, one other thing I did want to add, before we get into, our wonderful guest that we have joining us tonight, that Erin McClellan, former congressional candidate, officially announced her candidacy for Allegheny County Executive. There's a story in WESA that we'll share in the comment section, where she, appears to be trying to carve a niche, as a progressive who's running anti-establishment, but also, I think, is clearly trying to separate herself as a candidate from, the Summer Lee, Sarah Innamorato, coalition. I think there was definitely, comments and quotes within the article that folks would clearly draw, to, the candidates that have been supported and will be supported, and part of, that coalition that is rumored to be supporting Sarah Innamorato for county executive. So, I thought that story was interesting. Miracle, I didn't know if you had a chance to see that recent announcement that came out this morning on WESA.
We did see the announcement, and for transparency, we'll be having an op-ed run in the future about why we're advocating for expansive voter access, including more ballot access and job sites. But it is going to be a very fun election year this year and next year here in Pennsylvania, particularly in Allegheny County, as we're electing not only a new county executive, but also a district attorney. And so you'll see a lot of people are going to be announcing their campaigns this week and next, and you'll see there is a lot of robust debate. No one has, the same ideas, and that's what's great for democracy. People are coming together, raising funds, running on platforms, and the candidates will be able to reach out to voters and let them decide who is the best person to lead this region. And again, it's going to be a fun, election cycle. But like we talked about earlier, elections do have consequences. The people you place in office often have an impact on what's going on around society. And the thing we're talking about today is, medical copays. A lot of times people like to say, well, some people go to prison, they have a place to sleep, a place to eat, and they get free health care. But that's actually not true, and that's not how it works. And so we have assembled a panel in conjunction with, Maria from FAM Foundation to talk about an issue that's plaguing our prisons right now, and that is the medical copay. We've gone through a whole entire pandemic. We were talking about burnout with medical staff, and one segment of the population that has been at the forefront of these pandemics has been those who have been incarcerated behind bars. And so they're here in Pennsylvania. Some people actually have to pay in order to see a doctor, in order to have medical access. But what does that look like when people do not have jobs? And of course, under the 13th Amendment, are not required to get paid a living wage. What does that mean for families? What does that mean for communities who have had their loved ones disappeared behind bars? And so to talk about the reality of the medical access in our Pennsylvania prisons, we have a wonderful host of panels. And first, from the Pennsylvania Prison Society, we want to welcome Anton, who is the research and education fellow, to talk a little bit about what is medical copay, how does it work, and what is some of the realities facing people behind bars. So welcome to the One Hour, Anton.
Thank you, Miracle, and nice to see you, Kahari. Hope you guys can hear me clearly. Everything good? Yeah, so my name's Anton Andrew. As you said, I am with the Pennsylvania Prison Society. For those of you who don't know, we are the oldest humanitarian organization in the nation. We were founded in 1787 by Benjamin Franklin and Benjamin Rush with the specific goal of serving people who are behind bars in Pennsylvania. What makes us unique and what makes us really important right now is people behind bars in Pennsylvania right now are generally talking about people in crisis. We've got the once in 100-year crisis created by this global pandemic that we're trying to get through, which just swept like wildfire through correctional institutions. And we also have decades of mass incarceration, which could quadruple the population of Pennsylvanians incarcerated over the last 40 years. So what we do is basically, between our staff of 10 people and about 350 volunteers who are highly trained and are known as official visitors, we go out to facilities and talk to people who are incarcerated to resolve their specific in-prison issues about their treatment and conditions. So if you or a loved one is incarcerated anywhere in any adult correctional institution in the state of Pennsylvania, the Prison Society is the only organization that has the same access the governor would to go into those facilities, to talk to anyone incarcerated there, and to advocate on their behalf to resolve the issues. We can't compel a facility to do anything, but we can shed light on what's going on. We can direct them where they need to go. And because we've been around for 200 odd years, we have a lot of credibility with those facilities, with the wardens, with the superintendents. And in many cases, it's simply a matter of helping guide somebody through the system, which can be really confusing and really opaque. One last thing about the kind of work we do to give you a sense of what we do. We responded last year to over 6,000 individual requests for assistance from people who were locked up or their family members. In response to that, we responded to every one of those requests for assistance. And in over 2,500 of those cases, we deployed those official visitors to go and speak to the individual within those facilities because we couldn't get it resolved over the phone or through the computer. So that gives you an idea of what we do, and that gives you an idea of what's unique about us in terms of we have the best sense of what is really going on, what life is really like behind bars across the state. And right now, like I said, given the those two crises that we are facing, it's more important than ever that people on the outside realize just how awful life on the inside is at this moment.
And you talked about how awful life is on the inside. Can you just explain to people what are medical co-pays and how is that impacting the access to medical care?
Okay, sure. Yeah, medical copay is really simple. Most of us, or many of us, deal with medical copays all the time. So basically, if you're an incarcerated person in the state of Pennsylvania and you initiate a sick visit, you say, I want to go see the doctor, the nurse in my facility because I'm not feeling well. You, depending upon the county, depending on the facility, will have to pay a copay. So, for instance, the city of Philadelphia, very wisely, does not have a copay for people in its custody who initiate medical visits. But our State Department of Corrections, which has about 2/3 of the incarcerated population in any given day at its 23 state correctional institutions across the Commonwealth, they have a $5 copay. So if you initiate and you're in a state correctional institution, you're going to be paying a $5 copay. Now, if the facility initiates or requires you to do something such as the COVID vaccine, you don't have to pay the copay. But again, you say, I feel sick, I have a headache, a stomach ache, an earache, as you'll hear Joanne, who's coming up later, she's going to talk about, her family member who had a situation like that. You initiate and you're going to have to pay that $5 copay. So that might not sound like a ton to people. People are like $5, it's not a big deal. Or people might ask, why are people who are locked up and in the state's custody forced to pay for the copay? Well, this really started back in the 90s as we were in the middle of this explosion of people that we were locking up. Like I said, quadrupled over the last 40 years. And it was designed, copays, to kind of offset or recoup some of the costs counties and states were now facing because their populations were expanding and they were locking up so many more people. And they were locking up more and more people who were dealing with issues of addiction, or people who were dealing with chronic diseases, or people who were very medically fragile. As a result, it seemed like a good idea at the time. But the truth of the matter is, and what we've learned since then, is that copays keep sick people from getting the care that they desperately need.
Besides obviously the healthcare ramifications, and obviously the economic impact, on, inmates, other unforeseen kind of unintended consequences
Sure.
Associated, with having a system like this?
Yeah, so you touched on a couple of them right off the bat. First of all, let me start with the reason copays were created. It's an invalid reason right now. Copays don't recoup costs. For instance, the Department of Corrections has a $250 million medical budget. You want to guess what percent of it they recoup through copays? They recoup less than 0.2% of that budget from copays. So it's the taxpayers who are paying 99.8% of the medical budget. The copays are a drop in the bucket, and that's even before you take out for all the administrative costs that are involved with trying to recoup the copays from people, in most cases, who've been deemed indigent by the courts. So the copays don't recoup money. Secondly, the copays put everyone at risk, not just the people in facilities, not just the people who work in those facilities, as we learned during the COVID pandemic, but the communities they come from. Because if you have a disease, it can quickly spread throughout the facility and then go back into the communities to where either the corrections staff or the people who are incarcerated who are eventually released return. So if people don't get treatment while they're in custody, they're ticking time bombs. And finally, the copay just puts medical care out of the reach of people who are incarcerated. In Pennsylvania, where you have people working between 19 cents to 51 cents, the top wage an hour, in state correctional institutions, a copay is the equivalent of somebody making minimum wage in the state, $7.25, paying over $200 as a copay to go visit their doctors. Or in the case of state representatives or state senators, paying over $500 to go see their doctors. And we recently did an education session, the Pennsylvania Prison Society and FAM, with several caucuses in the Senate and the House earlier this year. And I think there's a link to that. But you should have seen, or you should have heard the silence when I asked the gathered elected representatives in there, how sick would you have to be to pay $500 to see your doctor? So the copays don't make sense on any level right now. And that's why we asked the Department of Corrections earlier this year to eliminate the copay. It is something that they did earlier in the pandemic per our request and suggestion, but they have since reinstated it. And unfortunately, we're back in the same situation that we were when it was there before. It doesn't make sense for anybody.
Yeah, and as you wrap, is there any legislation on the table that would correct this? And where is that at in the unwinding process of what it is Pennsylvania legislation?
No, you know what? Legislators on both sides of the aisle realize it makes no sense. We have a Republican senator, Senator Bartolotta, Senate Bill, I believe, 1296. I think we have a link to that, to end the $5 copay. And then we have a Democratic representative, Representative Almond Brown, has similar legislation in the House. So it's clearly not a partisan issue. Now, the problem with it is we have a partisan legislature. So to move any legislation through is going to take a huge lift. And a lot of people are going to suffer needlessly during this period unless the department changes its policy. And the simplest, most direct way to do that at this moment is to call the governor and tell him, we need to end the copay right now. I think we have the number, but I can give it here if it's not in a link. The number to the governor's office, the line is 717-200-7122. And tomorrow we are beginning a call-in day, and we're inviting anyone who's concerned about this issue. And this should be anyone in the state of Pennsylvania, because frankly, as a taxpayer, the third largest expenditure we spend money on every year, the third biggest chunk of our taxes goes to our prisons. That's $5 billion statewide. 2.7 billion of it goes to our state correctional institutions. And we have the ability right now to tell our governor, hey, let's make a policy that makes sense not only for the people who live there, but for the taxpayers, because keeping sick people from getting the treatment they need, and I think Dr. Kaleem is here, he'll talk probably more about that, but when people don't get treatment early, they end up having to get more expensive and invasive treatments later on. And again, that makes no sense dollar-wise, or it makes no sense on a very human level. So encourage you to call your local state senator or your state representative around those bills. But tomorrow morning, tomorrow afternoon, tomorrow evening, call the governor so the message is loud and clear. We need to end the copay right now.
Well, thank you so much, Anton, for coming and talking and giving it. That even I forgot about. That is one of the top expenditures for taxpayer dollars is, our prison systems. A lot of people think, oh, it's our schools, it's housing. It's our prisons. And so this is one of the ways that we can all get together and call, like you said, this is a nonpartisan issue. That's something that impacts everyone here in Pennsylvania. So thank you so much for joining us this evening. We have all the links in the chat. And, we wanted to have a conversation about the context of the history of medical copays in prisons in Pennsylvania. We wanted to have a little deeper, further conversation of how this is actually impacting people and those who have loved ones and friends and family members who are incarcerated. And our next guest is Joanne. Her brother has spent, almost 3 decades incarcerated here in Pennsylvania prisons on a mandatory death by incarceration sentence. And through that situation, she has unfortunately become very familiar with the ways in which Pennsylvania prisons operate, how they impact families, and how they are treating those who are behind bars. And she joins us now to talk about her story and how it's impacted her brother and why these medical copays have to change. And with that, we want to welcome Joanne to the Power Hour. So welcome, Joanne.
Hi, thank you for having me on. Good evening, everyone. I'd like to start off by piggybacking off of Anton. Quite a few things that he said is that my brother, he had an incident last year in May where his back was hurt, and it was extreme pain. He had to go to infirmary. Again, he had to pay the copay, the $5 copay. He went many times, and he was in such severe pain that eventually he wound up having to go to an outside hospital to get an MRI done, which is very expensive. So a lot of time went in between when he first hurt his back to the time he got out to get an MRI. And now my brother is in his 38th year of life without parole, and otherwise known as death by incarceration. It is very, very, it's hard on us as family members, one, to see our loved ones suffering in pain or illnesses because they can't afford to go to the infirmary. Having to go one time is bad enough, but when they have to keep going back and forth, some of them they have to choose between paying $5 or suffering silently to buy commissary or to be able to call home. When my brother was injured in the worst part of it, he couldn't even walk. The men were thankfully helping him get around. Someone let him use their wheelchair, because he would have had to pay for that also. So if so much time hadn't lapsed between when the injury first happened to getting out to have the MRI done, what was maybe a simple problem, we didn't know that at first, but maybe it could have been treated differently and even prevented it from getting worse. So in the meantime, it has gotten worse. He has severe spinal stenosis. He has slipped disc, displaced and impinged nerves on the main exiting nerves. And 2 doctors told him that he has to have surgery done. So that was over 6 months ago, and still nothing has happened. And he's not receiving any medicine or any type of treatment whatsoever. So, to say that, they should have to pay, they're in there, they did a crime, correct, that's true, but that also falls on myself and my family members and other loved ones' family members, because, these men and women are only making 19 cents to what my brother's at top pay at 42 cents an hour. That's an hour. That takes a day and a half, 18 hours almost, just for the copay itself. And so we as family members, we're subsidizing that money. And, we're not free by any means. Not free, I'm sorry. We're not wealthy or, have extra money coming in. I mean, my sisters are, they're elderly themselves. They're on disability. I also help subsidize my own income by, going to a food bank twice a month, just so that, as I'm living paycheck to paycheck, it's important to make sure that I always have enough to get my brother taken care of. Again, that money that they make 19 cents to 42 cents an hour has to cover commissary, which, they have to buy their own garments, their own shoes, anything that they need for hygiene, to shower, to brush their teeth, phone calls. If it weren't for my brother being able to call me through this whole entire last 15 months, I wouldn't know, I wouldn't have known that there had been a fire in the prison or something burned up and caused all the smoke detectors to go off, and his whole unit had to go outside in the yard. And thankfully the men, helped him get out there, and the pain was so severe they had to actually get him up on a table just so he could, withstand being out there until they could come back in. He's in his 38th year. So that means for 38 years, we as family have been helping every month to subsidize what he can't do on his own. And so not only that, but I'm also a taxpayer. I work a full-time job, 5 days a week. And so I'm being basically paying twice for a $5 copay that could get them, commissary for that week, or, there should never be a time where you have to choose whether or not, you're going to pretend not to be sick because you can't afford to go, or, go, just, it's just hard. It's hard on everyone around.
Yes, thank you. Thank you so much, for that. I know you talk, it's very difficult to talk about, your circumstances, and I do thank you for being vulnerable. But like you were saying, this medical copay, it's each time you go into the doctor.
Right.
Some people have to decide whether they're going to eat that week or go to the doctor. Have you heard about other situations for other people, and what has that been like?
I have. There's someone that I know who has a loved one at a different prison, and this man has lost hearing in one ear due to chronic infections that didn't properly get taken care of through the years. So now the other ear is having problems where he's having a hard time hearing out of it. There's some really bad drainage that's coming out of it. They don't quite know what's going on. So then he has to keep going back to the infirmary to get the infection treated. And he's been going back and back and back so much, and nothing's been done. So now he's possibly on the verge of losing the hearing in his other ear, but yet he's not going back to the infirmary because he can't continue to pay the $5 copay every single time he has to go back. So now his choice is to, it's not being treated. This is something that was minor, an ear infection that if it had been taken care of properly and swiftly, maybe he wouldn't have lost his hearing. And now, sadly, the same thing is happening to him. And, how much more expensive is that going to be to have to help someone now with hearing loss? It just doesn't make any sense. It's a vicious cycle.
Yeah, I had a quick question. I mean, it appears that the copay, is an issue, but it also appears that even when folks are either stretching, their resources as much as they can, or may have the resources to cover the copay, even when you are paying the copay, it still appears that, the level of care, isn't adequate. Can you speak to a little bit of like what, is the broken part of this, medical system, beyond, the barrier that the $5 copay creates? It still appears that, even with that, there still is some structural issues that prevent, those in the healthcare, departments of these state institutions are not providing adequate care for the residents of these correctional facilities.
Well, I mean, their concerns aren't taken seriously. There are some really, really nice and very helpful medical staff, nurses, that I know have treated my brother very kindly. But then there's also medical staff and nurses that have treated them horribly. They're not nice. They're not compassionate. it's just a, kind of get them in, get them out. And it doesn't matter because they're in prison. So why should anybody else care, what kind of medical help that they get? But they committed a crime. They're serving that sentence. They're still human beings that need medical care. And sometimes it's the people that are in the infirmary, whether it would be the nurses or the doctors, sometimes their hands are tied and they want to do something, they want to help, but they're not being permitted to do that. So, there are, it just depends on who's calling the shots. And he's been waiting now over 6 months since 2 doctors and said that he needs this surgery. And it's sad that that they're just not getting proper care. Just let's put a Band-Aid on it, or, okay, well, somebody's in pain, so let's just give them some pain medicine and we'll just keep on supplying you with pain medication instead of taking care of the real problem, which down the road is going to be a lot more expensive than just trying to keep somebody on pain medication or not offering them any pain medication at all. And then that leads to more injuries. And we have an elderly population in the prisons that, it seems like, this is turning into nursing homes. Just, if we did some preventative care on the forefront and just take care of what needs to be taken care of. And the biggest thing would be eliminating that $5 copay right now, to where these men and women don't have to choose between going and getting something checked out, which could be a terrible headache, terrible earache, something intestinal, which could have been prevented, but turns out to be something major. Now it's 10 times the amount that it would have been to take care of it.
Thank you so much. And as we wrap, is tomorrow's action, people are going to be targeting, the governor. Is there a message that you do have for the governor when it comes to this medical copay?
Yes, I would like for Governor Wolf to eliminate the copay altogether, permanently. It was eliminated during COVID. It didn't hurt anything. And we want to be able to not have to go. I don't want to have to subsidize my own income in order to have my brother see a doctor.
All right, Joanne, thank you so much for taking
Thank you.
time out of your Monday to sit and talk with us. I hope you enjoy the rest of your evening.
Oh, well, thank you so much.
Oh, you're welcome. And so our last guest, we talked about the context of Pennsylvania and its role in incarceration. We've heard directly from an impacted loved one, but our next guest is someone who's actually in the medical field, who's advocating for these changes, who's working with this population. And Dr. Zane from Physicians for Criminal Justice Reform is with a group of physicians who have been advocating for changes and reform, not only for the medical providers, but for some of these policies and systems that Gar was mentioning earlier. So we want to welcome to the program Dr. Zane. How are you doing?
I'm coming from an organization called Physicians for Criminal Justice Reform. This is a national organization of physicians, physician assistants, nurses, students, medical students, residents, and people who are also just allies in general, family members who have connected with us, who care about this issue and who have been fighting for this issue for the past couple of years, various issues within criminal justice reform over the past couple of years. I myself am the Pennsylvania local organizing chair. So I do all of the work that's related to our advocacy in Pennsylvania. And so the first thing that we jumped on was this $5 copay issue. This was something that we were alerted to when FAM Foundation came together with Anton and the Pennsylvania Prison Society, and they put out a letter to the governor, a letter to Secretary George Little about this copay and how they wanted it eliminated. This was earlier this year, and we had been alerted to the copay issue here in Pennsylvania from them, and then we jumped on it because this copay issue really embodies everything that Physicians for Criminal Justice Reform stands for. We fight for issues at the intersection of the criminal legal system and healthcare justice and equity, and there was no issue that kind of embodied what we do more than the copay issue. And so we joined just a couple of months ago. We put out our own statement the way that they did, talking about why this issue can really exacerbate people's problems. Here's the thing that really concerns me about this copay, and the reason that we jump in is that this copay, the $5 copay, when you consider that somebody in prison makes 19 cents an hour minimum wage, 42 cents an hour average wage, and then you consider this $5 barrier to getting care. This person has to work 12 to 26 hours in order to see the doctor just once, have a new concern pop up. Let's say somebody has a new onset of shortness of breath, a new onset of a slight cough. This person has to consider, can I work the 26 hours on my 19-cent wage? Can I work the 12 hours on my 42-cent wage to see the doctor just once for this cough? Is it even worth it? Because this cough is just a small thing right now. So should I even get it checked out? And oftentimes for people in prisons, when they have to balance their wages with everything that they buy from the commissary, the way that we were just talking about, people are always going to choose to buy soap from the commissary. People need soap for tomorrow. You need soap tomorrow in the morning to wash your hands. You need toothpaste tomorrow morning just to do basic hygiene, right? People are always going to choose the short-term option that's going to be most helpful for them over the long-term option that's going to be beneficial for them, which is to go see their doctor. The problem with the copay is that it keeps people from getting the care for their minor conditions, and it leaves their minor conditions to ultimately end up becoming worse. And these minor conditions are often just symptoms of a bigger disease, So this copay really just flies directly in the face of everything that primary care medicine stands for, and that's intolerable. That is unbelievable. That is something everybody should be outraged about. That this whole model of everything that physicians do is just being basically thrown in the garbage with this copay. Consider somebody who has a new mole, for example, a new mole pop up on their skin. A mole oftentimes is not a big deal, right? And people don't really think twice about a new mole. They look at it, they say, fine. I just have this new mole. It's one of many. The thing is that oftentimes a mole can be a sign of a melanoma. It could be a smaller sign, an early sign of a melanoma. And if you catch it early, it's something that's very easily taken care of by a dermatologist. It's something that can be removed right away, but before it causes any spread throughout the body, before it becomes a full-blown melanoma, which is a skin cancer. And these smaller conditions that we see are things that can be taken care of easily if people just had access to regular primary care. There is no reason that somebody should have to consider whether their condition is big enough to see the doctor. There's no reason that somebody in prison should have to try to consider whether their condition is big enough before they see the doctor versus buy soap for themselves. We shouldn't be expecting people in prisons to diagnose their own conditions before going to the doctor, right? What I mean by that is that we've been told at Physicians for Criminal Justice Reform, we have been told that people will not have to pay the copay for problems relating to their chronic conditions. Let's say somebody has diabetes. Now, diabetes, if it's not taken care of very well, diabetes can turn into a host of problems throughout the body. The thing is that if somebody ends up having one of these complications of diabetes, let's say somebody with diabetes now is having trouble seeing just a little bit, right? It's nothing too major. It's just a little change in their vision. They don't think twice about it. The thing is that this could be a sign of diabetic retinopathy. I mean, this is not, this is not a small thing. This is a small sign for now that could be taken care of early if we figure out that it's your diabetes causing this problem in your vision. But that can only happen if you go to your doctor. That can only happen if you go to your doctor. There's no way to figure this out on your own, and we shouldn't be expecting people to decide, oh, okay, I have diabetic retinopathy. That's why I can't see right now, right? This is not the expectation we should have of anybody in prisons. And so this is why the copay is just a complete outrage. This is why my entire organization has jumped on this issue.
Thank you so much, and I appreciate your passionate plea about this. And what for us, the grievances that people have to file to see the doctors, or the wait behind bars. There's so many things that are impacting access to care. And I know you have some information that you wanted to share with us, so we'll go ahead and pull those slides up now.
Yeah, so you can play the slides while we talk a little bit more. The slides are for people to read while we talk. It's nothing in particular I'm going to be speaking about are in the slides. The slides are extra bonuses for us here, except for the last one. We'll get to the last slide in a bit. One of the things I wanted to mention.
Go ahead.
One of the things I wanted to mention is going back to something that Joanne said was the whole balancing act. The whole balancing act that people have to play with buying basic things from the commissary versus going to the prison healthcare system. Just to give a perspective about this, people are making 42 cents an hour on average. We've established that. Soap in a commissary, in the PA commissary, the soap will cost 83 cents. So 83 cents, that's 2 hours of work right there to buy soap, one single bar of soap. You take toothpaste, it costs $1.36 in the commissary, $1.36. So that's 4 hours of work for somebody making an average wage to just get one thing of toothpaste, right? And so there is this balancing act that continues. I mean, nobody's going to pick going to the doctor for their cough over toothpaste for tomorrow, over toilet paper for tomorrow. And then on top of that, people have to balance. People also have to balance their money in terms of in terms of the food that they buy from the commissary, because oftentimes the food that's in the cafeteria is not providing people the full nutrition that they need throughout the day, and so people have to supplement oftentimes with food from the commissary. And so when you get food from the commissary, you think about, well, what are the options that people will have? You can buy a beef and cheese steak for 57 cents, which is a horrible idea in terms of nutrition, or you could buy Raisin Bran cereal, which is $3.10. I mean, the contrast is just absurd, and it makes it even more difficult to just have basic nutrition while you're in prisons, because of the cost of these things and the balancing act that you have to play just to keep yourself healthy while you're in prisons. There's a lot that goes into this for people, and it's a really personal issue for people, and to deal with all of this that's often unrecognized because people don't talk about these issues.
Thank you. We know with the pandemic, you had coronavirus, now we have monkeypox. Outside of those being, mass disability creating, events, that's also something that has been plaguing people's mental health. People didn't have access to visits, didn't have access, some people couldn't go outside. A lot of facilities were on basically, 23-and-1s. And so we're also seeing an implosion of psychiatric issues. Is that still impacted by the medical copay, and how does that operate?
Yeah, so this is one of the things that they tell us is that within the copay policy, mental health is covered. Is what we're told. Mental health is covered, and so the thing is that when it comes to mental health, fortunately, we don't have entirely the same issue. Because people don't have to decide whether they have a mental health condition or not. If somebody feels depressed, they feel depressed, right? And they'll go see the doctor, and then they know from the beginning that they're not going to be charged the copay. So fortunately, there are good aspects of the copay, right? These things have unintended consequences later down the line, but for some conditions, we're lucky that the copay doesn't exclude people from every type of care. It's the biggest issue that we have is that the copay is keeping people from going to their primary care doctor when they have a new condition pop up. Just basics, just small symptoms come up that could be signs of a larger issue. It could be anything from like diabetic retinopathy, like we talked about, all the way to a cancer, and anything in between. There's tuberculosis is much more common in prisons than it is outside of prisons across the country, and so there's a lot of things that people need to be checked out for if they have certain symptoms, and it's important to see your doctor rather than try to diagnose yourself. One thing I do want to mention is that, at the end of the day, 95% of people who are in state prisons across the country are going to be released into the community. There are people who are going to return to the community and be our neighbors. They're going to be our partners. They're going to be our coworkers. These are people that we should be setting them up for success as they leave prisons. We shouldn't be trying to exacerbate their medical conditions while they're in the prison and then leave them worse off when they're finally released after however many years or months that they spend in the prisons. There's no justifiable reason for that, especially when these people are going to be part of our society. We should be trying to help them out. We should be trying to help create better people. If that's the concern, we need to create better people. Or if the concern is that the person didn't have proper education, the person did not have a proper education, for example, then these people should get proper help while they're in prison so that they can be more productive people in society. At the very least, we should not be exacerbating their health conditions. That is one of the biggest concerns that we have at Physicians for Criminal Justice Reform. Everybody should be concerned about this issue. I wanted to mention finally that we do have the call-in day, and we've been talking about the call-in day a little bit throughout this podcast now. And I wanted to bring it up one more time because this is the most important point for today. For everybody who cares about this copay issue, we have a call-in day that was organized by FAM Foundation, and you might be able to put that slide up as well with the phone number. But FAM Foundation came together and put together this call-in day. They have a whole hotline that's going to connect you directly to the governor's office tomorrow, and we need everybody to call the governor's office tomorrow throughout the work day, during your lunch break. Even leave a message in the evening when you're after work. Whatever you can do is going to be really helpful for us on this issue. The numbers matter, and the governor needs to see that a lot of people care about this issue like we do. The number that you got to call tomorrow, which is the hotline that FAM Foundation came up with, is 717-200-7122. And I'll repeat that one more time. That number is 717-200-7122. Make sure you call this number tomorrow. Join us in the call-in day. This can be the turning point for the copay in Pennsylvania.
Thank you, Gary.
I just had one quick question. In the op-ed that you wrote for the Pennsylvania Capital Star a couple months ago, you talked a little bit about one issue that I thought was really interesting and important in this overall discussion. And it talks about how the inefficiency of how our correctional institutions are run exacerbate the challenges associated with providing medical care and proper medical care, as well as obviously the unjust charging of the $5 copay. Can you talk a little bit about the role of just the inefficiency and the overall cost of running Pennsylvania's prison system also becomes a hindrance to providing quality medical care to the residents of correctional facilities around the state?
Yeah, certainly. So I have a quick comment on this one, and that is that the copay, Anton kind of touched on this earlier, but the copay in Pennsylvania generates about $500,000 in revenue for the Department of Corrections. After that, in order just to administer the copay, in order to just get that $500,000 from the $5 copays that people pay, the department itself has administrative fees to pay all the people who are part of that administration to create the infrastructure to even collect this copay, and that the cost of that is much higher than $500,000. I'm forgetting the figure on that, so I apologize, but it was more than double if I remember right. The cost to even administer the copay in the first place. That inefficiency leads to basically missed opportunities where you could be instead paying for people to actually be able to provide care. You should be paying for more nurses. You could be raising nurses' salaries so that you get more nurses to come in. There's so many better ways to use a lot of the money that's put into the Department of Corrections, and we're just not doing it. We're not doing it in Pennsylvania, and that is the biggest inefficiency that we have out of all the ones that I would like to talk about.
Well, Doctor, thank you so much for joining us. And as we wrap, is there a way people can get more involved with your organization? If there's any medical practitioners or medical students who say, you know what, this is why, I came to medical school, this is why I'm interested in a career in medicine, how can they reach out? How can they be a part of your campaign? Because like you said, you are a national organization.
Yeah, certainly. I'll tell you, this is the reason I came into medical school. So I definitely identify with those medical students who chose this field for the reason of advocacy. If you want to join Physicians for Criminal Justice Reform, definitely visit our website, pfcjreform.org. You can contact me directly. My name's Zane, Zane, at pfcjreform.org. You can also follow us on Twitter. You can follow us on Facebook. We're very active on social media, always sharing everything that we're doing. These days, sharing a lot of things from Pennsylvania. So if you want to get involved, I'm a Pennsylvania guy. If you're from Pennsylvania and you want to get involved, I'm happy to get you involved. We already have tons of students who've joined us already, and they've done incredible work with us.
Perfect. Well, Doctor, thank you so much for joining us. I hope you enjoy the rest of your evening, and we'll look forward to hearing from you tomorrow for the National Call-In Day.
I really appreciate the opportunity. Thank you so much to both of you.
Thank you so much for joining us.
And with that, that has been this week's edition of the 100 Power Hour. I hope that this was something that really enlightened you about what's going on as people are seeking medical care within Pennsylvania. It was very important. One of our guests wanted to make sure we noted that in order to get medical care in Pennsylvania prisons, you first have to file a grievance, right? So you're not just able to just go to the infirmary or to seek medical care. You first have to file a grievance, submit paperwork, and then wait for that claim to be heard. And that these are what's causing a lot of barriers to access to care. And so people are calling it tomorrow. Like Dr. Zane was saying, this is something that is costing upwards of $500,000. I mean, over $1 million to process. And that money could go to expanding care and cutting costs that would actually help improve the lives of people, because again, 95% of those who are serving time in Pennsylvania will be returning to communities, and those illnesses and those diseases left untreated become larger issues in a broader society. So please make sure you're calling in tomorrow. And again, we're going to reiterate, I know people sometimes get frustrated. This is why it's very important to be active within the electoral system, making sure you're voting, making sure that you put people in position of power who are going to be responsive to your demands, because all of this falls within the electoral system. The governor is elected. The governor makes his appointments to a lot of these committees that oversee what's going on in the prison. So it's very important that people vote. The legislature sometimes approves and denies these people in these positions of powers. So again, for checks and balances, you still have to vote. So please make sure you're registered to vote. Here in Pennsylvania, the deadline is October 24th. And with that, I will put it over to Kahari. And for a quick clarification, Anton wanted to say you do not always have to file a grievance. You do have to file paperwork to request a visit. And when you do not get that visit or adequate care, then you file a grievance. Want to make sure we have the correct terminology for you all this evening. And with that, I'm going to turn it over to Kahari, who's going to wrap for us.
Thanks so much, Miracle. Again, I want to thank Anton Andrew from the PA Prison Society, as well as Joanne Schilk and Dr. Zane Kaleem for joining us and giving us a lot of very, very important information about what is happening in our state's correctional facilities. So this has been the latest edition of the 100 Power Hour. I am your co-host, Kahari Mosley, always with my illustrious co-host, Miracle Jones. And again, I want to thank Anton, Joanne, and Dr. Zane for joining us tonight. Please join us Sundays at 7 p.m. for the Sunday night sit down. and Mondays at 7 p.m. for the One Hood Power Hour. We are going to be getting our fall election coverage very, very soon. It's almost September. Can you believe it? But again, thank you so much for joining us. We will see you soon, either Sunday at 7 or Monday at 7. Either one, it'll be a lot of great information, a lot of great insight, local leaders, as well as advocates from not only the Pittsburgh area, but around the state. Thank you so much for joining us. Have a great week. Good night.